Hi, I'm Evan Parks. I'm the author of the book Chronic Pain Rehabilitation, Active Pain Management that helps you get back to the life that you love. In this episode, I'm going to be talking about the overreactive central nervous system. What does that mean and why is that important? Well, when we talk about acute pain, we're talking about pain that is functional, pain that helps us. When we're talking about chronic pain, we're talking about pain that actually isn't very functional at all. It doesn't help us in any particular way. Acute pain shows up when we have an injury like a cut or a broken bone. During that period of healing, the brain says, yes, there's a threat, and then based on that assessment, it produces an output, and that output is acute pain. Well, when that healing has occurred and the body understands that the healing has occurred, the brain reassesses the situation and says, oh, pain is no longer needed here for protection, and it turns off the pain signal. When we have chronic pain, we have pain that is actually not serving a useful purpose for us. It doesn't protect us from anything, because the central nervous system is looking at almost all the information that it's getting from some particular area of our body as a threat, when in fact very little, if anything, is ever going to change with that area. It's not going to help us to be experiencing pain. So let's look at a very simple example to try to illustrate what this concept of overreactivity or oversensitive nervous system is. So picture a person from a small town. They move to Chicago and they're going to go to a university there. And they get this small studio apartment right in the center of the downtown area, right next to one of the elevated trains. Now, picture that person on their first night of sleep in their apartment. The apartment building itself is rattling and shaking from the train. The noise is deafening. There are fire trucks. There are police sirens. There are cars racing and screeching. There are noises and people talking from all the other neighboring apartments, maybe even people yelling. And that person's central nervous system is trying to figure out, wow, is this a threat? Is that a threat? What's happening? This is unusual. Doesn't know how to categorize all this information. So that person is not going to get that much sleep that night, if any. Now, after they've been there for a month, what happens? Their sensitive nervous system is now looking at all the sensory input differently. Rather than seeing the vibrations of the building and the sounds of the sirens and the sound of the train and the voices as something that's unusual, the brain says, hey, this is relatively normal. This is background information. Really doesn't pose any threat at all, so we don't have to focus on it. Now, that's actually what we want to see happen when we are trying to deal with chronic pain. So something is happening to your body all the time. As you age, from the age of your late teens, early 20s onward, you are slowly getting shorter. You know why? Because your spinal column is compressing. Why? Because it's deteriorating. Is that a threat? Not particularly. It's pretty normal. But somebody might tell you that it's a threat. They say, oh boy, let's look at this x-ray. Boy, your spinal cord is compressing here a little bit. And then the brain goes, whoa, what does that mean? This degeneration of my spine, what is that a problem? And then it gets regarded truly as a problem. So let's say that a person has a disc that's protruding a little bit, sticking out between two vertebrae in the back, and it's pressing against a nerve that's going by. And that condition of that protruding disc might have been there for a couple of years, and the person was relatively unaware of it. And then along comes a pandemic, along comes a job loss, along comes some marital difficulties, some financial stress. that person's central nervous system is wired. It is on high alert. There's a lot of threat. There's a lot of change. And all of a sudden, the brain begins to look at that lower back issue as, well, what is that? That's a problem. That's a problem. And it starts producing an output. And that output is pain based on the brain's assessment that that is now going to be regarded not as background information, but as a problem. And so it produces pain. So this is the part that I was talking about, that is chronic pain the same as acute pain? No, because chronic pain is not useful. This chronic pain actually doesn't protect that person at all. In fact, it interferes with their life. The very things that that person needs to do with that protruding disc is to get circulation to that area, better blood flow, better range of motion, better flexibility, strengthen the core, increase their cardiovascular health, increase, everything that can be done that improves the functioning and blood flow to the body. So walking, strength training, stretching, range of motion exercises, all of these things need to be done. Chronic pain is going to interfere with that. How is that helpful? It's not helpful. So when we have an overly sensitive nervous system, we have to be able to learn how to calm down that nervous system so that it's not so overly reactive and producing pain, which then interferes with our ability to function. So I look forward to talking with you more about this. If you have questions, contact me. You can also listen to the podcast version of this on Pain Rehab Podcast. And if you have questions, go to painrehabsource.com, find the contact information page, send me a message, and I'll be happy to help you. I look forward to talking with you, and we'll talk again soon. Take care.